it's me again. I didn't tell you guys about my ER experience while I was having my miscarriage. So we got up to my husband calling my mom. Um, so she's about a 10-minute drive from my house. So when she got here, she got off and we were, really crying, and she came in and she hugged us, and she told us that everything will be okay, that, things happen for a reason. And from here, she drove us to the hospital. I'm not sure if it was her or my husband that drove, that's all very vague to me. I don't remember who. Um, but the whole way there, I was having cramps, and I can feel like a period type cramping, a little bit more intense. Um, Blood clots, like women can feel blood clots coming on a period or at a miscarriage, but these miscarriage blood clots are a lot bigger. So I was telling them that I couldn't hold it in, that I was gonna just, I was saying, I'm sorry, I might stay in the car or whatever. They're just, don't worry about it. We're almost there. We're almost there. So the hospital's 20 minutes away, and it seemed forever, forever. So finally we get there, and I can't get off because I'm trying to hold it in so it all doesn't gush out. So my husband, or my mom, I think it's my mom, she helps me. She helps me up, and as soon as I get off the car, because we're like parked right at the emergency room. As soon as I get off the car, I I'm just stuck there. I can't move. I just cannot take a step, because as soon as I move, I feel like it's all going to come out. So my mom's husband goes into the emergency room, and that lady took forever. He went to go ask for a wheelchair, and finally 10 minutes later this lady comes out, not knowing what we're going through, and it's an emergency because I'm bleeding and bleeding. So she brings it. I sit down, and right when I sit down, I just feel it all come out. And I tell my mom, Mom, it's all coming out, Mom. And I feel like I'm dripping, and I think I did drip a few on our way inside. And so the nurse takes us back. She opens the door, she takes us back, and I tell her that I need to go pee, or I need to go to the restroom. So as soon as she takes us into the room, she asks my mom and mom's husband and my husband to step out so I can use the restroom, and she gives me one of those toilets, those porta potty, no, those little toilets with the little tin. So I sit on there and just gush it all out. It's big, huge blood clots. I almost fainted because they were so big. I didn't know, I didn't know that big of a blood clot could come out. So as soon as that happened, wait, rewind a little bit. Before I sat down, I gushed a lot to the floor, and I told the nurse, I'm sorry, nurse, let me clean this up for you. She says, relax, don't worry about it. We have a cleaning crew that comes and cleans the blood up. And I was just apologizing the whole time. I was so embarrassed. So then, I use the toilet, and then after that, she gives me, I didn't bring a change of clothes with me, so she gives me some hospital clothes, these hospital underwear, this hospital pad, which are huge, but they helped out a whole lot, because they can hold a lot of blood. So finally, the doctor comes in. He takes a look at me. He says that I didn't need a DNC because of the fact that I bled everything out. The baby was out, everything was out, but I was just going to keep bleeding for a while. And sure enough, I did. I stayed there a few hours because he wanted to make sure the bleeding wasn't too much. They did my labs to make sure the bleeding wasn't a lot. And that was the end of it. They did take the baby in a little cup to do some exams on it, or I don't know, something on it. But I never heard anything from the baby, but what can we do? So yeah, that was my story. But if you have any questions or anything, just let me know and I'll be happy to answer. Thank you for listening. Bye.